Morning guys. I just wanted to make a quick update about my post-op revision breast lift, which I had done last Wednesday. Today is the 19th of October 2013. So I'm a week post-op, doing really well, basically back to normal now. I've adjusted to everything that's happened with my boobies, so I'm pretty good. I still have a lot of limitation with my movement, but working on it. I'll do a body shot later, but I wanted to quickly put together a quick list of things that I think helped me prepare for surgery. I had to have quite a lot of things that my surgeon said that I had to have before my op. Probably number one was my binder, which was an actual a surgical binder. I did do a video with has like 3 awkward straps, and it was a horrible thing that I hated, and I probably wanted to set fire to it by the time I had to stop wearing it. But I needed that, and I needed to take that into hospital with me. So that was number one. Number two thing that I would recommend having is some Spanx underwear, because from, I think, probably about my 3rd week in, I stopped wearing the binder and started wearing the Spanx, and they were black and they went underneath everything, and they were a lot less awkward than the big bulky thing that I usually wore. And my surgeon said that was okay, so I loved that. That was so much better than wearing that big horrible thing. So black Spanx with the little shorts and everything, like full all the way up to here, they were great. You can always go and get that afterwards though, but it was a pain to kind of find them. After surgery, you don't really want to go out and like be trying to find stuff because it's just irritating. I had to have a post-op bra to take with me into hospital. So they're those lovely things that do up at the front. I would also recommend trying to find some, not necessarily do up at the front, because probably about a week after, or 2 weeks, no, not a week after, probably about 2 weeks after, you can actually just put, you don't have to do stuff up at the front anymore, you can put stuff over your arms. It is a little bit painful, but I would recommend getting a couple of like R-bra sort of things, like crop tops that don't have any underwire in them. Get them in black, because all the post-op bras come in white and they're ugly and they're very hard to hide. I would get a couple of those in black, and just make sure you get like maybe one size up, because you need to account for that swelling that you've got going on. You don't want to end up with one that's way too small for you, because that is super uncomfortable when your boobs are healing. Number 3 item that I think was really good for me to have was I just bought a whole bunch of pillows to prop myself up in bed, because you can't lay flat for ages afterwards, like a good month after. You're not going to be able to sleep laying flat. I got a triangle pillow, and I got a couple of other like tube pillows, because you want to put something underneath your legs, you want something underneath your back, you have to like basically prop yourself up in bed. So that was useful. I also wish that I had organised some sort of protein drinks to take into hospital with me, so pre-made, ready to go, because the hospital food, first couple of days I was having a lot of heavy carb sort of stuff, and I really wanted to have that protein because I know that it helps you heal, and they didn't really give me that much protein. So I think my partner brought me some Up and Goes, which weren't really that great because there's so much sugar in them, so I would have preferred to have had my own that I'd picked out myself. Number 5, this one is huge. I didn't even think about it at all, but having a shower chair for in the shower when you come home from hospital. Oh my gosh. The first day that I got back from hospital, I tried to have a shower without one, and I almost passed out, because you're like, you have to lean over and you can't like do anything, and just standing takes so much effort. I was actually really lucky. I could borrow a shower chair from a relative of mine, and that was like the most useful thing I've ever had. And I only had to use it for probably about 2 weeks after I came back from hospital, so about 3 weeks I was, sitting in the shower, because it was just heaps easier. Especially if you're going to try and wash your hair and everything, it's just, trust me, it helps. And then number 6, just some button down tops for when you're in hospital, because it's a lot easier to, when you're laying down, to slip something behind you and do it up, and you don't have to sit up, you don't have to muck around trying to get it over your head, you just like wrap it around yourself and button it up. I was lucky enough to find like one singlet sort of top that had buttons. That was useful, but keep in mind, if you're going for cotton or something that doesn't have any stretch in it, you need to go like quite a few sizes up if you're getting your boobs done, because I made that mistake. I got a cotton shirt and it literally wouldn't do up the first couple of days, so I couldn't even wear it because you have that massive swelling. So go for stretchy if you can. Stretchy is good. And also invest in some comfy jeanie pants or leggings, like stuff like that, because, and especially if you're going to be wearing them to work, you kind of need to think about that, because I've only just really gotten back into jeans recently, like comfortably, and I'm like a good 11, 12 weeks post-op tummy tuck, and that's the main reason why jeans hurt, and like anything sort of structured. Definitely invest in something that can come high-waisted, that's loose. I seriously lived in jeanie pants for a good, like the first 10 weeks or so, jeanie pants, that was all I could wear. And you can kind of get away with wearing that to work because sometimes they look nice. So yeah, they were really probably the most important things that I got. What else did I... There's nothing really else that I'd majorly pre-prepared. I mean, I did need to get some tape to do my dressings afterwards, but that wasn't a huge deal. I just popped into the chemist and got it. I had to have this lovely stuff, Chlorhex wash, for before my surgery, but that's the sort of stuff that my surgeon told me to get. It wasn't like, you know, stuff that I figured out afterwards. They kind of just said, get this. But yeah, that's my list of like really important things that I didn't really want to go and hunt for afterwards, and I wish that I had known about them before. But anyway, back to my surgery. Oh my gosh, I'm so happy with my boobs. I just can't stop looking at them. I'm just like incredibly happy with them, even though they've still got tapes on them and I can't really see what they look like, but oh my gosh, the improvement is massive. I am, as I said, a week post-op. I've been doing Bikram this week, Bikram yoga, which I've been finding to really be helping loosen up all of this, because from the tummy tuck, my stomach is super tight and like my flexibility has just suffered heaps. And because I can't do that high intensity cardio with my boobs at the moment, the Bikram is perfect, and like getting that sweat and moving all the toxins out. And because my when you have a tummy tuck, all of your lymphatic system has to reconstruct around the area because it all gets cut off, and that's why you get that massive swelling, is because your body is trying to get rid of all the waste and it can't get it through because all the little things need to reconnect. With the Bikram, I think it's helping a lot with my swelling because I'm sweating out a lot of the stuff that my skin would normally have to deal with. So that's making me feel really good. I've done 3 sessions now. The first session was so ridiculously hard. I felt like I was going to pass out probably at least 5 times, like getting actual spots in front of my eyes. But yeah, it's really good. You just drink heaps of water the day before and you just sweat, and like, I'm obviously not very good at the poses and stuff, but you know, I'm trying my best. But anyway, I wanted to make this short, so I'm going to cut it off here, and I will insert a photo of the difference in my boobs at the moment. I'll do a quick shot because I did say I was going to. I think I'm 12 weeks post-op tummy tuck. There's my beautiful scar. Light's doing crazy things in here, as usual. Where can I stand? I'm doing this like first thing in the morning so you can see what my stomach usually looks like. But oh my gosh, it's so flat, and like this, like, because he does this thing where he like sculpts a line in the middle to like give you that sort of, like, you've got abs. I love it. I'm in love with my stomach. And I can't show you my boobs, but you can kind of see where my nips are sitting now. Yeah. So yeah, I'll insert a photo and I'll talk to you guys soon. Bye.